Welcome to the forum at the Harvard School of Public Health. We're here to talk about the humanitarian crisis in Syria. My name is Aaron Schachter. I'm the assignment editor at Public Radio International's The World. I'm today's moderator, and I spent 7 years in the Middle East. Went to Iraq, Afghanistan, Syria a number of times. Luckily, never during a humanitarian crisis like this. This event is a collaboration of the Forum and PRI's The World and WGBH Radio here in Boston. The Forum is a live webcasting series about health policy produced at the Harvard School of Public Health, which is celebrating its centennial year. Webcasting 100 years ago was a trouble, as you might imagine. This event is part of a larger Harvard series on Syria's humanitarian crisis, and you can find out more about the series on Twitter. The hashtag is HarvardOnSyria. Today's panelists, starting from my immediate left, are Jennifer Leaning. She directs the FXB Center for Health and Human Rights. Jean Gilman is advisor to MIT's Security Studies Program. Michael Van Rooyen directs the Harvard Humanitarian Initiative. Recep Akdag is the former Minister of Health for Turkey. And joining us remotely is Paul Spiegel from the UN's High Commissioner for Refugees Office. He's joining us from Geneva, and unfortunately, as an embodiment of the UN, he's got to run off to do something important at about 1:15. Today's program is an hour long. We'll start by framing some of the humanitarian issues that face Syria and its neighbors, Turkey chief among them. And then we will explore practical ways of dealing with the situation. And we hope to have time at the end to take questions. We'll take some questions online and then hopefully here in the audience. So with that said, we thought we'd start with a video from the UNHCR, the High Commissioner for Refugees Office, with an overview of the issue.
Syria, the country shattered, its people engulfed in conflict, its neighbors bearing a brutal burden. 3 years of pain and devastation, the great tragedy of this century. In Jordan, a rough city rises from the desert, sheltering over 100,000 Syrian refugees. In Lebanon, rural and urban refugees live where they can, clustered in tents or abandoned buildings. In Turkey, 21 camps in 10 provinces. In northern Iraq, these Syrians find refuge in a park. Egypt, where more and more Syrians seek safety or a route to Europe. More than 2 million refugees. Syria is hemorrhaging women, children, and men. And inside Syria, over 4 million displaced. More than half the human flood leaving Syria are children. 1 million children, 70% under the age of 12. Children like little Holler, only 3 days old when her family fled to Iraq. Or 4-year-old Sahad, her face scarred, but her life saved. Or Aya, whose hope is to go to school. Or Abdullah, who works to feed his family. The tide does not subside. Last month, over 40,000 refugees crossed a temporary pontoon bridge in northern Iraq in just 1 week. Borders are overflowing. Support is critical and critically needed for communities hosting so many refugees. Neighboring countries have shown great generosity, but the strain on economies, on infrastructures, is acute. Water, food, education, healthcare, housing. This crisis requires more than life-saving humanitarian aid. It urgently needs robust economic development to help host countries cope. Across the region, the sense of a future has been broken. Life now is reduced to survival and waiting for peace and a path home.
Now that video is a good overview of the problem. We at The World have had reporters go to many of these refugee camps. We've had people do reports from Armenia, from Greece, from Europe. But I think part of the problem is that this tends to just wash over people, doesn't it? You hear it on the news, and it's just sort of same story, different day. And part of what we hope to do in this panel today is kind of tease out some of the problems facing refugees in and from Syria, and then some of the solutions. We'll start with Jennifer Leaning.
Thank you. This war, which has gone on now for 2.5 to 3 years, is one of the most vicious and brutal conventional wars that a government has waged against its people in many years. The international community has watched and wrung its hands, as you're all aware. What you're seeing in that video, and what a number of panelists are going to talk about, is the inevitable consequence, that is forced migration of people fleeing a very heavily militarized assault on their homes and their cities and their modes of livelihood. It is important for us to think about this war in some of its peculiar facets. It began with a really outrageous attack on children in homes that were putting up graffiti in the spirit of the Arab Spring, saying, "We want freedom, this government has to go." They were imprisoned, tortured, mutilated, some killed. That fed a homes uprising, and thousands were killed in that uprising. Recapitulating what Assad's father, Hafiz al-Assad, had done in homes over 30 years ago, massacring somewhere between 10 and 40,000 people. History is repeating itself in terms of Sunnis against Alawites, Sunni being the majority population, Alawite the minority and part of the regime elite. This war has demolished one of the most important and oldest civilizations in the Mideast. It is situated in one of the more politically volatile areas of the Mideast. Political analysts are suggesting that this is not likely to bode well for the future of the country of Syria as an entity. The ways in which we analyze this certainly will include the vast numbers of people who must be cared for within and outside, who are fleeing their own homes. But we also need to think about this as a unusually harsh use of military weapons, high-velocity rifles, artillery shells, air warfare, that has led to a very high demand for sophisticated medical care from the humanitarian community, both within and outside Syria. And that is an issue that is going to be addressed as well on this panel. I think it's also important to recognize, as we look forward on this, there's an element of drought, if not climate change, that has contributed to some of the movement of Syrian farmers, Sunni primarily, into the more urban areas, which has then aggravated the communal divisions between these two major populations in Syria that we have watched guardedly for years. There was ample early warning of this. The international community, once again, has not responded except in the humane way and the humanitarian way that Paul and Mike are going to talk about. And then on top of this, fiercely conventional war, quite one-sided in terms of weaponry, we have the recent use of chemical weapons, which adds literally and figuratively a toxicity to this war that, again, is not seen yet in this century, and hopefully with the response of the international community will not be seen again from the standpoint of chemical weapons use. We're watching a real calamity unfold here, and it's not a misfortune. It is an aggression with failure to act on the part of the international community.
And that is the perfect segue into Jean Gilman. She's Senior Advisor at the MIT Security Studies Program and an expert in chemical weapons.
I want to begin following up from what Jennifer has been saying with an emphasis on the harshness of and the unexpected brutality of the use of chemical weapons in Syria. It wasn't really anticipated by any other state or any UN entity at all. It just came so from out of the blue. And the strangeness of it is that it's such an obvious transgression of international norms, but also very specific treaties. For example, the Geneva Protocol of 1925 is a very explicit ban on the use of chemical weapons. And lingering out there also is the International Criminal Court, which defines the use of chemical weapons as a war crime. So it was a very strange transgression that we saw going on here, and maybe at some point we'll get to the bottom of why this all happened, but it did happen. So I want to just go back a little bit in history and give you just a few facts, a thumbnail sketch, if you will, about the history behind the Chemical Weapons Convention. Now, the Chemical Weapons Convention is this entity, a standing organization in The Hague, which is the place where you find the Organization for the Prohibition of Chemical Weapons, that acronym OPCW that you keep hearing on the news. And that is a group, if you will, an organization within an organization whose mission is to go around the world and basically witness the destruction of enormous stockpiles of chemical weapons, the stockpiles being declared by the state parties to the Chemical Weapons Convention. Let me back up historically a little bit on this. You go to Ypres, it's 1915, it's the First World War, and the Germans have invented the idea of using chlorine gas. And if you go to Ypres, and it's 1915, they release from 6,000 tanks of chlorine gas an enormous cloud over a battlefield, the result of which is the deaths of about 6,000 of Canadian and British and some colonial soldiers. So that's the beginning of it. But behind that, all right, if you will, the background for that is really the 20th century as the time in which we're going to see the joining of science and industry for the making of weapons. And it makes the 20th century really extraordinary because you do have a little bit of this and that going on in the 19th century. You have the invention of the machine gun as the 19th century invention. Go into the 20th century and you're going into big time science industry warfare. And as you move into the 1920s and the 1930s, you have the theory that justifies this enormous power that states have. And it's called total war theory. And with total war theory, you have one state making war against another state with the goal of obliterating the industrial might of that other state. Now, what does that mean? That means you attack cities, you burn down bridges, you go after economic structure, and in the middle of that mix, you kill civilians. So if you look back on the 20th century, you see this incredible increase in the deaths of civilians because, in fact, it's legitimate. It was all right to do because that's the way nation states make war on each other. After World War II, the major powers decide that that's not what they want to do because, by the way, it's economically a terrible idea. We had to, after bombing Germany and bombing Japan, we had to pay to restructure them. It was a big economic cost, right? So we don't do that anymore. But we had client states, if you'll notice, who actually do pick up the notion of total war, and they pick up our weapons. So what do we have by the end of World War II? We've got chemicals, we have chemical weapon arsenals, because although you have the 1925 Geneva Protocol, which forbids the use of chemical and also biological weapons, you don't have any ban on arsenals. You don't have any ban on the production, the development, the transport, getting ready to use those weapons as, let's say, in retaliation. So if you have the buildup of the arsenals, so it's chemical. By the end of World War II, we certainly have the United States absolutely in the forefront of biological weapons development. An amazing program, not as expensive as the atomic bomb program, but getting up there, very, very expensive and very well developed. And then, of course, you've got the atomic bomb. You've got the ultimate incinerator. So what happens after World War II is that smaller states begin to say, well, listen, they've got that stuff, we want that stuff. We want chemical, we want biological, and we want nuclear. And that's exactly what happened. So you have enormous proliferation of these weapons, all of them, by the way, aimed at civilians. Now, initially chemicals were for battlefield, but when you get to post-World War II, we find out that the Germans have invented nerve gas. Not just Cyclone B, by the way, for the camps, but also Tabun and sarin and a variety of others. So then we have something new in the arsenal. And it is the United States that pioneers this, but it proliferates all around. So I give you that as the background. We have it, just follow through with me. Client states, the United States doesn't really want to get involved with the Middle East, but let me see. Israel has chemical weapons, biological weapons, nuclear weapons. That's interesting. There's a parallel. You've got Syria coming in now, which we know about in the 1980s with their chemical weapons. We had Libya, by the way. You had South Africa, apartheid South Africa. Look around the globe and you see this proliferation of WMD. And it all is all to emulate the larger powers and to get that kind of extra, what we call cachet, right, in the international world. All of it is anti-civilian. So you come up to the Iran-Iraq war, and you have a use of chemical weapons that, again, was hardly predicted. The United States, even though it had its ally in Saddam Hussein, behind the scenes was really horrified by what he was doing and by the attacks on the Kurds that happened in the late 1980s. All right, fast forward with me, the Cold War ends. It's 1992. And by the way, Russia at this point doesn't want anything to do with its chemical weapons. We want to get rid of our chemical weapons. We're tired of the arsenal. And that tiredness with the arsenal, by the way, goes back to Richard Nixon in 1969. He bans biological weapons entirely and puts severe restrictions on chemical weapons. Why? Well, they don't give you what conventional weapons can give you, and they don't give you what atomic bombs can give you, right? They don't have the deterrence power, and they don't have the conventional strategic or tactical power. So everybody wants out of this, and that's why you get the 1993 Chemical Weapons Convention. Everybody wants out of these weapons because, in fact, they are anti-civilian. They're repulsive weapons. So what can we do? Well, the idea of the Chemical Weapons Convention was to, first of all, get the 30,000 tons of chemical weapons that the United States had destroyed and simultaneously destroy the 40,000 tons of the former Soviet Union, Russia. So that was the mission in 1993. Now, it took until 1997 to get the treaty, the Chemical Weapons Treaty, to come into force, that is, to really be effective. The treaty was held up by one man in the Senate, Strom Thurmond, who thought that it was a plot against the sovereignty of the United States. Anyway, it comes into effect in 1997. And then these teams, OPCW teams, begin the supervision of the destruction of these chemical weapons. They are at 80% of the destruction worldwide of these chemical weapons. It's phenomenal. It's wonderful. It's one of the best stories of the 21st century. Get rid of this stuff. It's dangerous. It's harmful. It can hurt people. And it's not controllable, as we have seen. It's very difficult. I think even now, as the teams are going in, as they are in there, and they're witnessing the destruction, the beginning, we hope, of the destruction of the stockpiles, that we won't see accidents, that we won't see civilians in danger, that we won't see the teams in danger. And these are concerns that everyone knows about right now, and that we're all following. We're tracking these very carefully. We're hoping that the stockpiles are not in areas which are contended areas, but which are government-controlled areas. By the way,
we'll look at what comes next in just a few minutes.
In 2 days, by the way, the Syria will have become a state party to the treaty, and that's extremely good news, and we'll see what happens with it.
Thank you. Next is Michael Van Rooyen. He directs Harvard Humanitarian Initiative. Michael.
Thank you, Aaron. I actually want to give a counterpoint to the issue of chemical weapons, which can be seen from the humanitarian response perspective as distracting. Because the issue of chemical weapons, while very important from an international law perspective and certainly from a mass kind of casualty perspective, accounts for, 2% or so of the casualties that we've seen in Syria. The 115,000 deaths have really occurred because of direct attacks on civilians from conventional weapons, and also the deprivation of resources. So I want to mention just two things briefly before my colleague Paul Spiegel gets on the line. The one issue is the types of medical response that are the sort of destruction or stress on the medical system, and then difficulties in accessing health systems and the ability to actually provide services. The first is that if you think about this kind of a conflict, the epidemiology of illness is different than, say, other refugee emergencies that we might think about. These are not Sudanese refugees, for example, crossing large spans of land. This is in urban settings and populations that have enjoyed actually an excellent health system and an excellent public health system previously. So the reason that people are dying are for traumatic reasons, for chronic health reasons. For example, their deprivation of their sort of chronic medications. They're hypertensive, they have cardiac disease. So it's a very different population than, say, our sort of concept of refugees. What that means is that the health system or the health services need to be higher level, right? They need to be tertiary care services providing surgical facilities and not only doing, war surgery, but actually taking care of women who need C-sections, for example, or people who need surgical care, or on the medical side, people who need diabetic care, things like that. So our causes of mortality are both by deprivation of resources and by the lack of being able to care for people because of direct trauma are very different than other concepts of refugees. In addition, this war is quite different in many other respects because of the extreme restrictions in access. It's very difficult to gain access. Matter of fact, MSF and several NGOs recently have made a point that they have seen weapons inspectors and chemical weapons inspectors moving freely throughout restricted areas to inspect and destroy weaponry, where humanitarians and people who are trying to get humanitarian access to provide food, water, medications, surgical services can never get that access. And it was a bit of a paradox in that the only people with access are the people addressing the very political issue of chemical weapons, where the real humanitarian needs of medical surgical care and very basic provision of services, we can't access those regions. So the extreme deprivation or the sort of deprivation of populations because of lack of access is a significant issue. One additional point is that mental health is a huge issue. So while in this conflict up to 15% of the population is suffering from major mental health issues, debilitating mental health issues that really affect families and communities, and we as a humanitarian community are not great at dealing with mental health issues. And then my final point is that the targeting of healthcare workers in general also creates the problem with sort of accessing health services. So there's been a flight of 15,000 Syrian physicians from Syria, and in the Aleppo region, 5,000 physicians left. There remain 37 physicians to care for a large number of the population, meaning that there's an incredible need for external assistance to provide very basic services, and the medical staff are completely overworked, notwithstanding the fact that they are also targeted. So in this era of there's no longer neutrality or medical neutrality. So healthcare workers, 100 or more healthcare workers have been imprisoned and killed, Syrian healthcare workers, for suspicion of caring for rebel militia, for example. Just this week, I think there was an MSF surgeon killed, and there have been several hospitals that have been bombed. 37% of Syrian hospitals are non-functional because of attacks, and 20% are severely injured. So the lack of medical neutrality, compounded by the difficulties in providing high-end medical care, make this a unique and difficult crisis in which to address medical issues.
Thank you, Michael. We're going to skip over Mr. Aktag for just a moment, and you'll see why. Next is Paul Spiegel. He's the Deputy Director of the Division of Program Support and Management at the UNHCR, and he joins us now from Geneva. Paul?
Great, thank you, and good evening or good afternoon for you, everyone. And I want to start by just saying how severe and the magnitude of this emergency, as the High Commissioner said, we haven't seen anything, and it's a completely different type of emergency, but since 1994 in Rwanda. So the amount of stress that it's putting on the Middle East, but also on the humanitarians is really unprecedented. A couple quick numbers for you. There's now been over 2.175 million refugees that have fled Syria proper. Lebanon has taken the brunt of 780,000, followed by Jordan 540, Turkey 500, and then Iraq 200, and Egypt 125,000. Some of these countries, Jordan and Lebanon, are very small, and we won't go over how many refugees that would be in the U.S., but it is extraordinary. And the first thing we have to say is that very few countries in the world would actually be as hospitable and generous as these countries, and that needs to we really have to emphasize that. The response is, it's very clear that, and as it said in the video, that the humanitarian response is at this point really just a Band-Aid, and it's gone well beyond what we can actually do as a humanitarian community. We currently have 126 agencies, government, UN, NGOs, of which national, international, and faith-based, trying to respond to this. It is the largest appeal that we've ever done. It's for 2013. It's $2.98 billion for this appeal, of which there's only 47% has been funded. And so we're making some very, very difficult choices, and I'll mention that briefly in the medical area. As Mike mentioned, these are middle-income countries. The demographic profile, the disease epidemiological profile are much more similar to the U.S. and Europe than we've dealt with in the past. In, for example, Chad. Clearly, it is much more expensive to respond, and there's always a question of equity. But we are responding at a much let's say a higher level, of course, than we are in the Democratic Republic of Congo. And that's something that certainly can be discussed. But generally, we try to respond at a level similar to where refugees have come from and where they are. One of the biggest problems, as Mike mentioned, is access. And we can talk briefly about camp and out of camp. Camps are magnets for the media, for the politicians, and for the humanitarian organizations. And if you look at Zatri refugee camp in Jordan, it has received, I would say, a disproportionate amount of medical help compared to where the majority of refugees are outside of these camps. They're diffuse within the population, and the type of services that they try to access really depends upon the disease and the cost. Lebanon in particular is extremely complicated because there are no camps. They're mostly dispersed throughout the country. And Lebanon is a privatized healthcare system and very, very costly. We have tried to, one of the biggest, I would say, challenges is secondary and tertiary healthcare. We're trying to prioritize public health, primary care, and emergency care, particularly emergency obstetrical care. But the secondary and tertiary healthcare we're dealing with, it's very similar to the Iraqi refugees. We're dealing with very, very costly diseases, cancers, cardiac bypass, renal dialysis. And due to lack of funding, which is understandable, we really have to prioritize, and we have what we call exceptional care committees, local doctors and UNHCR doctors that have to make very, very difficult decisions according to prognosis and cost of these these illnesses. This has been very, very difficult to do, but it means that at times we have to deny care to certain individuals, and then we have to try to work with others. The last thing I'll mention is that, which is relatively new, is that there are many, many Islamic agencies now that are getting funds from the Gulf and Saudis and elsewhere, and coordination is a very, very big issue, and how we coordinate with these agencies has been challenging, to say the least. But there is a complementarity that can be had, particularly in healthcare, because they do a lot of one-off care. And so this is a big challenge that we need to look forward to working more with in the future. Thank you.
Thank you, Paul. And very quickly, as Paul said, there are 500,000 refugees in Turkey. And we have a short video provided by the UNHCR with specific issues in Turkey.
Nizip Camp, a sea of tents that stretches out into the horizon. Children play amongst the washing lines whilst their mothers look on. Located in the province of Gaziantep, this is one of the 17 camps built and maintained by the Turkish government. Over 8,000 refugees live here. Today, the camp has a special visitor, UNHCR High Commissioner Antonio Guterres. He sat with Syrian families, listening to their stories of flight. Raida walked 2 days to reach the Turkish border. She lives in this tent with her 6 sons.
We were coming from Syria. We came from Syria. We came because of the bombing, because of the shelling. My husband died in the shelling. I lost my husband.
It's a very big tragedy.
إنه طبعاً هذه مأساة كبيرة جداً.
Last week, we have registered more than 1 million people that fled the country.
يعني للأسف اعتبار من الأسبوع الماضي إحنا علمنا إنه أكثر من 1,000,000 سوري ترك سوريا.
But there are several million inside Syria that badly need assistance.
بس لا يزال.
The Turkish government says it has spent over 800 million funding these camps. They are home to over 185,000 refugees. Turkey has now begun registering Syrians outside of the camps. At this local centre in the city of Gaziantep, Guterres saw the registration process in action. After the refugees are interviewed, they are provided with a registration card. They can now receive access to free healthcare and additional aid. To date, over 40,000 refugees have registered, and there are another 31,000 awaiting registration.
So as you can see, Turkey is working very hard to settle the Syrian refugees, and few people know that better than Recep Akdag. He's the former Minister of Health from Turkey. Mr. Akdag.
Thank you. It's a real tragedy in Syria. I mean, we are the witnesses of that real tragedy, real brutality in Turkey, because we have very large, very big border in Syria, and we have some relatives in each side. I mean, they were always seeing each other before these conflicts. So we have hosted all of them in our country, and we feel that the Syrian people in our country are not refugees. We feel them like our guests. And we provide all of the needs for them. I mean, they have their temporary houses, they have health services, they have education for their children, food, clean water, sanitation. But unfortunately, it doesn't solve the problem. I mean, okay, we give services, necessary services for the people, they flee to Turkey. But there are many others in Syria, we know the situation. I mean, the tragedy is so big that a dictator keep on bombing their citizens from air by his air forces. It's a real tragedy. You can understand some conflicts between two sides. I mean, there are two sides, and they have some conflicts. They are fighting each other. Army forces. It's not good, but it's a reality. But it's really impossible to understand for a government bombing their citizens by their air forces. So in our country, both in the camps and both outside the camps, we give all the health services and the other services to Syrian people. I mean, we took them whenever they need by ambulances, and we give all primary health care services in the camps and outside the camps. And whenever they need, we refer them secondary or tertiary hospitals. For example, we examined more than 1,500,000 Syrian citizens in primary healthcare centers. We admitted more than 300,000 people to hospitals, inpatients more than 36 patients, and delivery number more than 6,000 in Turkey from Syrian pregnant women. But as I said before, it doesn't solve the problem. It must be, it has to be ended in some way. All the things, and then we are talking now, we are discussing some aspects of the problem now, are palliative for the situation. I mean, the war, the bombing of the people by air forces has to be ended. And in my opinion, the international community, the United States, has that power. We, as public health people, always take care of the, of course, health issues. But how do you think that such a kind of dictator would permit you to go to Syria and then help the people? It's not possible, because they have been bombing their citizens. I mean, they don't care about the health of their people. So it's the real problem, has to be solved. Of course, we will continue to give all the services to Syrian people in Turkey. As I said, we feel them our guests. I mean, the number is not important. Maybe it will increase. Now, approximately 500,000 people inside and outside the camps. We keep on giving all the services like our citizens, but it the situation itself need to be ended.
Thank you, Recep. So our five panelists have sort of laid out a fairly pessimistic outlook on what's going on. What we'll do now is we'll solve the problem to the best that we can. We have some very renowned professionals here. We'll start with Paul. Where do we go from here, Paul?
I wish I knew. One area that we have been trying to look at is recognizing that the humanitarians are. This is well beyond a humanitarian problem, and also recognizing that, particularly in Jordan and Lebanon, the amount of refugees there are causing a tremendous strain on existing services, and so we are trying to work with development agencies. We're working with the World Bank, UNDP. You know, development and humanitarian aid and the way the mechanisms work are extremely different. And so we're trying to work with them to expedite areas, for instance, you name it, from roads to redoing water, sanitation, anything that can help the hosting communities that at this point are suffering or beginning to suffer almost as much as the refugees in certain situations. So that's one area we're doing a lot of joint missions together with the bank, particularly, and parts of the EU, to try to expedite funding, development funding that will have a larger effect on the systems.
And Paul will have to leave us in just a moment, so I want to get another quick question to you. Do you think people understand, governments understand that this is such a huge humanitarian crisis? I'm not sure even I realized that it was bigger than Rwanda and Darfur and all these other places that we've heard about in the news.
I think the governments do. The problem is the public. It's very hard it's because it's so large now. It's very hard, I think, to have the average citizen in the U.S., Canada, where I'm from, wherever, to really understand the extremity of the situation. The numbers are so big that they become almost meaningless, and I think that's one of the problems. When you just look at what happened recently you'll forgive me, I can't remember how many deaths, 100 or so deaths of crossing into Italy recently. People can relate to that much more easily they can than hundreds of thousands of refugees fleeing at this point.
Okay, thank you, Paul. Paul Spiegel is
I'm going to leave now.
Paul Spiegel is the Deputy Director of the Division of Program Support and Management at the United Nations High Commissioner for Refugees, the UNHCR. So, what is next? What have we learned from the past 2+ years of warfare in Syria? As you said, things have changed. Healthcare workers are now targets. They're weapons of war. We talked about this before. Formerly, there used to be safe corridors, safe passage where humanitarian workers could go, where aid could flow. Those two things have disappeared. What do we do now?
Well, can I just make one point to build on what Paul was saying, which is that the humanitarian agencies, whether they're NGOs or they're UN agencies, like UNICEF or UNHCR, were set up in the apparatus after World War II and in the 50s to deal with emergencies. Increasingly, with these long-lived wars, many of them not with the high arsenal weight that Syria is subjecting its citizens to, the duration of the war and the duration of the refugee crisis has meant that, not speaking about Syria, we have upwards of 40 to 45 million people around the world that are in long-lived, internally displaced, and refugee settings. And those that have stayed for a longer period of time, that is upwards of 7 years, in refugee status now, this is not IDPs, their prospects of going home ever again are diminishing. Now there is, of those who stayed over 7 years, they are now facing a 20-year mean stay in refugee camps. So with the fertility levels that are bearing on these populations, that's 1.5 generations. This is a custodial role. And we're not talking about Palestine. This is not talking about the refugees in Palestine. This is a custodial role for the humanitarian community that they've never been set up to do. So what Paul is talking about is imaginative. None of the machinery meshes development and humanitarian. It is a way out of this situation that UNHCR in particular have been trying to figure out, but it's not going to be accomplished in the time frame that we're facing now, which is the shredding of Syria, the destabilization of the adjoining countries in many ways, the vast impoverishment of the people who have fled. They've lost everything, and the misery that they are now enduring. This is, speaking of next steps, there are many next steps on the positive side, but on the international humanitarian law side, the legal side, what al-Assad has committed is a massive crime against humanity, and it needs to be something that is, of course, going to be brought up before the International Criminal Court, even before the use of chemical weapons. But what is extraordinarily difficult for those of us who have been watching this unfold, and I'm speaking now, I know, for everyone on this panel and for Paul, what's extraordinarily difficult is that the international community, starting at the level of the Security Council, has been unable to intervene to stop this massive catastrophe from occurring quite suddenly in 2.5 to 3 years. And unless we get that machinery in better shape, there are going to be other and similar major blots on the early 21st century with tremendous amount of humanitarian suffering.
Michael, I wonder if when governments, when politicians are taking into account how they will deal with a certain situation, do they even think about humanitarian aid? Because certainly, you know, as Jennifer says, if you stopped the problem 2 years ago, the humanitarian problem is much diminished 2 years on?
Well, I think governments know very well the power of humanitarian aid as a way to say you're doing something, right? So this, the answer in Syria and in the region is not a humanitarian answer. It's a political, maybe military answer, but it is not humanitarian assistance. Humanitarian assistance is simply to provide emergency life-saving support for a population under extreme stress. It is not going to change the problem. I think the things that we need to consider, sort of progress for the humanitarian community, in other words, things that'll help this situation anyway, at least from the humanitarian side, is to do things like, and I think Paul's suggestion was probably the best one, and that is to keep this from being a regional destabilizer by helping shore up the services of Jordan and Lebanon and in Turkey, for example, and even Iraq, to manage these large flow of refugee populations and also to secure them and to make it not so much a strain, because otherwise what is a regional issue will become a greater regional destabilizer. I think another thing that can be done is to create corridors of humanitarian access. The humanitarian aid community has actually evolved greatly over the last 2 or 3 decades. I mean, it's become far more professional. It's become more able to manage humanitarian crises and to coordinate with each other to do so. The problem is this is huge. And so it's the scale and it's the complexity and it's the lack of access to this crisis that make it really unique. So it is not that the aid community is broken, really. It's actually that the crisis itself is so huge, so overwhelming, so complex, and so difficult to access that aid can't do what it's supposed to do. So I would say that the answers to at least to assist or to see some progress forward would be to assist our neighboring countries in shoring up their kind of developmental capacity so that they can do well, create and argue for corridors of humanitarian access insofar as we're able to do so, coordinate better among ourselves, and mobilize funding that is, as Paul mentioned, difficult to come by.
Jean or Rachel, do you have anything to add briefly, and then we'll move on to questions?
Yeah, in my opinion, if the United States, the international community, were as serious, were serious about ending the war, as serious as giving some humanitarian aids or something, or stopping the chemical weapons, it would be successful. The international power, the United Nations power, is enough to do that. But we don't focus on that point. We keep on talking to give some humanitarian aids, but it's not possible. Okay, you can do something in the other refugee camps. Other than the Turkey, the situation is very good in Turkey, but you couldn't do anything in Syria without stopping the war, without stopping the bombing of the people.
Yes, if I could just add to that,
Yeah.
The strength of the United Nations, the strength of the Security Council, the political will among all parties is absolutely essential for stabilizing the Middle East. There are a lot of disparate efforts going on. There are a lot of behind-the-scenes efforts going on. But it's very, very important that there be, again, this political will and that the United Nations strength be admitted and be used because it can do amazing things. It was a year ago, August, by the way, that they sent in Admiral Mood to actually work in Syria, and that plan was not supported by the Security Council. Had it been, I think there could have been some progress, and that plan was actually killed by the Security Council, not being unanimous. So the chemical weapons issue, by the way, is one in which I feel very optimistic because it does admit the power of international convention. It is being supported, of course, by the United Nations, and it could perhaps lead to peace. It could lead to some negotiations for peace that would be stronger than before Syria actually became party to the Chemical Weapons Convention.
Yeah, I wonder if in some way, and this is probably not a good thing to say, but the the chemical weapons attack helped in a way. It called attention to what was happening.
Well, it also, it also engaged Russia, right? And so the engaged,
Unambiguously, yes.
it engaged Russia as a player and a negotiator in that. And so the Security Council, it's really all about the will of the Security Council to influence both the Assad regime and the other actors. So I think
Security Council.
Right.
Yeah.
It was a worldwide
Essential.
red line and not just a United States president.
So there is an agreement that if you get rid of your chemical weapons, you can keep on killing. That's the reality now.
There are a lot of moral forces against that. There's a lot of normative
Yes, but
work.
if
We've
you
got-
look at the outcome, that's the
but
reality.
wait. Look at the long view here. There are other mechanisms here. There are other plans being made, if you will. You do have the Geneva Conventions. You do have, the Geneva Protocol. You do have the International Criminal Court. These are not insignificant. There are pressures here, and I think that those pressures actually will come to good.
We have
I'm
before you
optimistic.
the glass is half full and half empty right here. We'll take questions. Hopefully we can get in a few. We'll start with online. Lisa?
Yep, I think we have time just for a couple questions, and we have an active chat going on online, so I just wanted to mention that. Yes, on our online chat. Here's one question. I'd like to know more about the conditions of refugees who are not in the camps. We touched on this a little bit. How do they get housing, food, and services outside of the camp structure? The first video showed families living outdoors in a park in Iraq who clearly were in need of everything. But in the second video, we saw people in Turkey who are not in camps getting processed with identity cards for services. How does all of this work?
It's complicated. Maybe Michael and I could share that. UNHCR is best equipped, as are the humanitarian organizations, to deal with refugees who are in a semi-confined area where everyone has an ID card, you know the family size, and you deliver rations and tents and set up water and sanitation. The volume of these refugees and the precipitous arrival has meant that the refugee camps have not been set up as thousands come, and so they drift. This is small countries. They drift into the villages and the rural areas. It is a bedeviling bureaucratic problem to find them, to register them, to call on the aid that has been, the meager aid that has arrived, and to distribute it fairly to the people who are essentially self-settled. And it is part of the enormous international headache that is now facing the international community. They are probably in worse shape. We know less about them. The children are still numerous. And it's this combination of the overflow in the camps and the self-settled refugees that are contributing to ongoing distress, including the major issues for child protection. Because in the camps, there are people overseeing this. But the problem is now that the families are so desperate. They're essentially selling their kids. There is very, very rapid increase in early marriage, all kinds of ways. Human trafficking is a very big problem. And this is in partly because there are so many, so fast, and many are outside the refugee camps.
Healthcare is helping us to record all the people outside the refugee camps, because we are giving all the health care free of charge. So they encourage them to be recorded and then get IDs in Turkey.
And just in my time in the field, and as I've worked in several of these settings, I've never seen a country respond in such an organized and appropriate manner as Turkey has in organizing the refugee flow and services. You could see it in the video, right? The camps that, in many respects, the Turkish government kept the humanitarian community out initially and managed all of this in a really an incredible way. So the services for those populations have been very organized, very well put together, and it's been a real, it's been an amazing feat. opposite of that, actually, is the internally displaced populations within Syria, many of them in urban settings. As Jennifer mentioned, it's an extreme, not only is it difficult to provide services to people in urban settings, but the extreme restrictions in humanitarian access means that there's millions of people without any access to external resources.
I'd like to add one more point about this humanitarian crisis and the human burden. And it links to Rach's point about the air war, and what Michael was talking about, traumatic injury. There are many people who are not dead, who are now surviving with penetrating abdominal wounds, with paralysis because of the weapons of the crush have hit their spinal cords. We were going to have paraplegics, people with ongoing abdominal complaints, people with head injuries who are alive but are disabled. And this community, as that I'm speaking here, it's not a community, this array of populations now that are scattered and deeply embedded in adjoining countries as well as in Syria, are not poised in terms of resources, manpower, and skills to deal with the rehab burden that a war like this is going to impose on the region. And that is a longer-term concern if we could get the political will and settlement that many of us are talking about. That is going to be a long-term concern for the region and an area for international community aid and development that we need to be thinking about already.
Do we want to take another online question?
You know, I think we're almost out of time, but I do just want to point out that all the questions from the chat will be on our website and people can see the activity there. We had a lot of panelists and a lot of material to cover, so we weren't able to take as many questions as we normally could, but this has been very fascinating, so thank you.
And we would also like to let you know that at The World, we're trying our best to keep this issue covered. As I started out by saying, there is some amount of fatigue with the sort of same story, different day. But certainly if there's something you think we ought to cover, or if there are comments you would like to make to us, we have a pretty far reach between our own correspondents and the BBC. We would be more than happy to have a look at that, and our website is pri.org, and we would love to hear from you, both studio audience and people online now. And we just wanted to thank you all for joining us at the forum at the Harvard School of Public Health. Our panelists, Jennifer Leaning, Jean Gilman, Michael Van Rooyen, and Recep Akdag, and of course Paul Spiegel, who is joining us from Geneva. Thank you very much.